Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and this is day 16 of the 80 Days to Your Dream Body course. Today's protein source is going to be turkey thighs with the skin, and today's going to be a back training workout. And the theme for today's workout is recovery. So, right now, I'm going to be explaining different modalities that you can incorporate into your training routine to help you recover quicker and enhance the effects of your workouts. Now, let's get started. And while we're resting, it is time to move on to the theme of today's video, and that is going to be recovery methods. And the first recovery method we're going to be discussing is one of my favorites, fascial stretch therapy. I've been practicing fascial stretch therapy since 2010, and it has been my go-to method in my physiotherapy clinic. It is basically a table-based form of assisted PNF stretching that uses special stabilization straps to anchor the opposite limb down. That way we can get a greater stretch in the limb that we are treating. With regard to fascial stretch therapy, there are 10 principles that we need to follow, and I'm going to be going through those right now. The first is that we want to synchronize the breathing with the stretching. The reason this is going to be very important because this is going to allow us to address any type of tension in the body. If our breathing is out of sync, what's going to happen is we're going to be fighting the patient on the table. Whereas if our breathing is in sync, we're going to be able to see what parts of the body are very, very tense and what needs a little bit more time and attention. The second thing is going to be that we want to regulate the nervous system with the stretching. Depending on how exactly we're performing it, let's say we have an athlete and we are performing it prior to an event, we would want to upregulate the nervous system. To upregulate, we would want to perform faster motions. Whereas if we are performing it post event or as a relaxation technique or something to improve posture, we would want to perform slower rhythmic movements. Then, principle number 3 is we want to stretch in a correct sequence. Generally, we want to create some space in the joint capsule and we want to go from deep to superficial and proximal to distal. Deep to superficial, so let's say we were doing the glutes, we would want to do the glute minimus, then medius, then maximus, and from proximal to distal, we would want to do the glute max, then the hamstring group, then the calf area. But that's pretty much the sequence. Next, principle number 4 is we want to stretch without pain. This is going to be very important because when they are in pain, that is going to activate the sympathetic nervous system and they're going to tense up and you're not going to get the best stretch possible. If we stretch without pain, then the parasympathetic nervous system is going to be activated and they're going to be able to get deeper into the stretch because they're going to be nice and relaxed. Principle number 5 is we want to stretch the fascia, not just the muscle. The entire body is interconnected. The fascia is the connective tissue that holds everything together. Let's take a look at the front line, for example. We have the rectus femoris that attaches from the patella to the anterior inferior iliac spine. Also at the pelvis, the rectus abdominis is going to attach. The rectus abdominis attaches to the superficial fibers of the pectoralis major, which attaches and crosses over the anterior deltoid, so it connects to that. And then the anterior deltoid, the anterior aspect of the glenohumeral joint, is going to connect to the biceps brachii. So if there is tension in the quads, it can be coming anywhere from that chain. So if we just address the quads without taking a look at the entire structure, we could be missing and not getting the best treatment possible. The sixth principle of action is we want to stretch through multiple planes of motion. The body is not a static position and it is not all in the sagittal plane. We want to address the coronal plane, the transverse plane, the sagittal plane, and take everything through different ranges of motions. If we want to take the glute into a stretch, we're not just going to go straight up and down. We can go a little bit more laterally to target the medial fibers, and we can go more medially to target the lateral fibers. Next, we would want to make sure that when we are stretching, we are expanding the joint capsule when we are stretching. The reason that this is going to be very important is because the whole point of stretching is we want to lengthen a tight muscle. So it stands to reason that if we create some space in the joint capsule, we're going to get a better stretch. And a simple experiment you could do on yourself is take your hand, push your index finger back. You're going to see it's not going to move very far. But if you traction and then move back, you're going to find that you end up getting a lot more range of motion, which brings us to the next point. Principle number 8 is we want to use traction in order to lengthen the muscle. Next, principle number 9, we want to use resistance when appropriate. Resistance is going to be the PNF, the proprioceptive neuromuscular facilitation. And with regard to fascial stretch therapy, the specific form of PNF is CR. We're doing contract relax method. And then lastly, principle number 10 is we want to adjust the treatment based off of the person's goal. So again, let's say we have an athlete and they're getting ready to perform. Prior to an event, we want to adjust things like the frequency, duration, the intensity, the speed, and the amount of resistance that we are applying. For somebody prior to an event, we're going to be going a lot faster and we're going to go a lot quicker into the movements. We're not going to do as many frequent attempts for each one. And the duration itself for the PNF is going to be a lot quicker. Whereas if somebody is a lot slower, they're a lot more relaxed, we're performing it after an event, the movements would be slower, we're going to contract a little bit longer, and those are just the 10 general rules. Over the course of the next few days, I'm going to be showing you some basic PNF stretching techniques, and it's going to be a simplified version of what I would do on a normal treatment. but our rest period is way overdue, so time for set number 2. Thanks for sticking around until the end of the video. Be sure to like, share, and leave a comment as it'll help the algorithm. And if you enjoyed the content, show your support by subscribing to the channel by clicking on the icon in the bottom right corner. And if you really want to show your support, then consider becoming a member by clicking on the icon in the bottom left corner. These new high quality videos aren't cheap to edit, and the $5 membership will really help with the video editing budget. You'll also get access to a ton of exclusive perks like early access to videos and this program design lecture playlist in the top right-hand corner. And if you want to learn how to do a one-armed pull-up, then check out the playlist on the top left corner.